We are bringing the podcast into the real world with our first ever in-person event, an evening of curiosity and conversation hosted in downtown Chicago, February 19th, 2026. Picture an intimate dinner party stacked with speakers, all guests from some of your favorite episodes, and space to make new child-free friends. Seats are limited, so you can read all the details and get your ticket by visiting Curious Life of a Child-Free Woman/2026 event. Welcome to Curious Life of a Child-Free Woman, a podcast exploring today's most interesting topics through the lens of a happy child-free life. Every week, I chat with experts inspiring us to think differently, live intentionally, and find fulfillment on our terms. Whether you're child-free or seeking a space where parenthood isn't part of the conversation, you are welcome here. It's not about comparison, it's about possibility. Before we start the episode, do you know about the Curious Life Club on Substack? It's a free community to enjoy bonus content and sneak peeks, and to connect with other cool women like you. Join us at CuriousLifeOfAChildFreeWoman.substack.com. Now let's get curious together. There is so much information available about women's health. We're told what to eat, how long to sleep, how to work out, what to test, and what to avoid. But the surge of information has also made it really confusing to live a normal, healthy life. Dr. Denise Au is a fellow of the American College of Physicians, and she spent more than 2 decades focusing on women's health, wellness, prevention, and lifestyle medicine, blending evidence-based care with a holistic approach. She believes good health is about understanding how your body works and how to care for our bodies in ways that are sustainable and empowering without fear and restriction. She now brings her expertise to Beyond, a private wellness and social club here in Chicago. I'm a member of Beyond, and that is how we met. I am so excited to have you here. Welcome, Dr. O.
Thank you.
Thank you for coming. What do you see as the state of women's health right now? Are we well informed, or do you think we're overwhelmed?
I think both. I think that there's such a wealth of information out there from many different places, friends, the media, the internet. I think it's very hard for us as patients and as physicians to sort out all that information and identify what's the best course of action for yourself. I think there's a overabundance of information from many different sources.
Yes. Okay. Well, you're making me feel less alone as a patient, because one day I'm on Instagram and I am thinking, oh my gosh, I had to get my hormones tested. I'm an idiot if I don't know my cortisol levels. And then the next day I'm focused on something totally different because I had a coffee with a friend and she's having something else done. So there's so much going on. And I feel like our relationships with our doctors are the right place to start to sift through this information versus TikTok or Instagram or whatever. Do you feel like women are comfortable? How are we having these relationships? Do you feel like we've made improvements there, or do you feel like we have room to improve yet?
I think we have room to improve because what I'd like to see is a patient's health being under constant surveillance so that we have these conversations about new therapies that we might try. If you have benefits, talking about those benefits. If you have side effects, talking about the side effects and being able to act on them. A shared decision-making relationship on an ongoing basis rather than just at your annual exam, I think is very beneficial.
I think women want that. I think if we could, we would have a more personal, I don't know if friendship is the right word, but it's such an intimate conversation that you're having. I feel like women want that. Do you feel like physicians want the same thing?
We do. We want to provide that personalized healthcare for you, definitely. And it's hard to do on an annual exam that may be only a few minutes as opposed to a conversation with a friend.
Yeah. What do we do about that? What are the barriers that keep us from having that more personal friend-like relationship? As women listening, what can we do to try to foster that with our healthcare providers?
Good question. I think appointments that are easily accessible, longer appointment times, and more regular follow up, I think are the things that I identify. And then being able to have the conversation both in person and then also virtually so that it can be an ongoing conversation. And there's different settings for these types of experience.
I forget about the virtual thing. A lot of practices introduced that during COVID and other things, but I forget about telehealth and that all of that even exists. I'm still in the mindset that I need to book an appointment and physically come. But you're right, we should be taking advantage.
Yes, not only virtually, but also now that we have the connection through the portal, that's also an ongoing conversation. So there's many ways to have the ongoing conversation in addition to a face-to-face conversation in the office.
And when you say portal, you mean those messaging portals that most providers have now?
Yes.
Love it. Okay, let's talk about midlife. I feel like I'm getting sick of this term already. I'm 38. I'll be 39 very shortly. And I feel like my whole world is consumed by this idea of midlife, perimenopause, symptoms, things that are coming. And I hear all this stuff about it, but from a medical perspective, I don't really know what's happening. I don't know what's coming my way. I don't know what to expect. And I don't know how to prepare for it. So, can we start like midlife medicine for women? What's happening to us in this season?
So in your 30s and approaching your 40s, you may see maybe some symptoms of perimenopause. It'd be a little bit early, but possibly hot flashes, night sweats, insomnia, mood swings. You might notice changes in your ability to exercise and endurance and symptoms after exercise, such as pain or decreased ability to do all the things that you wanted to do in the past. You might see changes in memory and cognition. So it manifests in all different ways.
Okay. The memory thing, let's go to that. Tell me more about the mental symptoms. I've heard friends who describe it as brain fog. Why would that happen in this season? What's going on?
Some changes that may be hormonally related. If you're having hot flashes, if you're having night sweats that are preventing you from sleep, that can affect cognition and memory and ability to recall. So all those are related. Mood changes too, depression, anxiety during that time.
Okay. I haven't heard about depression and anxiety being a potential part of this.
Oh, yes, that can be a part of it too. And whether that's due to the mood, the hot flashes, the night sweats, or if it's independent, it's hard to tease out.
Why do hot flashes happen? What's going on in our body that makes us hot?
Good question. So, our temperature regulation is centered in the hypothalamus. So, there are changes that happen there during the menopausal transition that causes you to have the hot flashes and night sweats.
Okay, so this stuff is coming from our brain. Am I understanding that right?
That's correct.
Even that, I feel like that's big news. But it is to me. We think of it as a body effect. I think we think of perimenopause and things related to our reproductive organs, but so much of what you're describing is actually brain related.
Centered in the brain, right? The neurokinins, the transmission of the neurokinins provides those symptoms of the hot flashes and the night sweats. The treatment is either hormonal replacement or non hormonal replacement. There's a variety of treatments for that.
Okay, let's talk about hormone replacement because as we're recording this, and I've done very little research on this, but I keep seeing it in the news just this week about this black box warning being removed from hormone replacements, I think. Can you tell us what is going on with that?
So, back in the 2002, there was the Women's Health Initiative that studied hormone replacement therapy in women. Generally, the women were in their 60s and above who they studied. They put them on estrogen and progesterone if the woman had a uterus, or estrogen only. And the study was to determine, does it relieve the hot flashes, night sweats? And then also the secondary outcome was, does it prevent cardiovascular disease in these women? And then what were the implications or complications of that? And the issue back then that they found there was an increased risk of breast cancer in women who were on estrogen plus progesterone. What happened as a result of that study is that they placed the black box warning on the hormones because of the increased risk of breast cancer. So for decades, that has prevented either the women asking for the hormone replacement therapy or providers providing the hormone replacement therapy, or both. And since then, retrospectively, they've looked at these studies and they've determined that there was a large flaw in the studies because the women that were in these studies were well past menopause. They were in their 60s and above. Whereas women typically go through menopause in their 40s and 50s. So those women were not included in the studies. The past few years, they have determined that they think that women closer to the time of menopause can benefit from the hormone replacement therapy in the relief of hot flashes, night sweats, and the improvement in quality of life.
Okay, got it. That's super helpful to understand.
This, of course, made the national news, and it was as important as the ending of the governmental shutdown.
Yes, which is exciting to see that women's health is on that caliber.
That is exciting to look at it in that sense. So I think in the future, what's going to happen is that there's going to be a much bigger increase in the women seeking hormonal therapy and in much improvement in the quality of life, because women spend 40% of their lifetime in menopause and postmenopause. So I think it can really improve the quality of life in the short term and in the long term. And I think what we might hope to see is that there is a prevention of chronic disease such as heart disease, stroke, diabetes, cancers such as colon cancer. I'm not sure that we're going to see that, but I would hope to see that, because right now the indication for hormone therapy is for the hot flashes, night sweats, for prevention of osteoporosis, and for treatment of the genital symptoms of menopause.
Okay, well, that's exciting to think about. I don't fully understand when we talk about hormone replacement. What exactly does that mean? Are my hormones going away as I near menopause and I'm just putting those hormones back? What's happening?
So, good question. As you go through the menopausal transition, women stop making the estrogen. When you stop making the estrogen, that's when you get the hot flashes, the night sweats, the brain fog, the depression, the anxiety, the insomnia, the changes in the hair and skin, the genital symptoms such as dryness. So, all those things happen because you're no longer making estrogen.
Okay, and then the replacement, the hormone that we're actually taking is estrogen.
Yes, the replacement that you're taking is estrogen. And then for women who no longer have a uterus, they're on estrogen only. And for women that continue to have their uterus, they're on estrogen and progesterone. And the progesterone is to protect the lining of the uterus so you don't get a thickened lining, which increases your risk for endometrial cancer. And the hormone replacement therapy is replacing what your body no longer makes after menopause.
Okay. Knowing that study was maybe done on women who are older than the typical time for this, when is the time, like at 38, should I be thinking about hormone replacement therapy? When is a time frame to think about it?
Good question. So, if you're not having symptoms such as irregular periods or hot flashes and night sweats, you don't need to think about that now. But when you start having those symptoms, the periods become regular, there's a longer interval between periods, or you start missing periods, there's a change in the menstrual cycle, you start having hot flashes, night sweats, the mood swings, the insomnia, that's the time when you think about starting hormones.
Okay. And how does it work? Are they like shots, pills? How do you take them?
So they come in all forms. Estrogen comes topical, so topical as a gel or topical as a patch or the oral estrogen. And progesterone comes as an oral tablet. Or estrogen and progesterone can come also as a combined patch. And then there's other forms too. If we're treating the genital symptoms of menopause, then it comes as estrogen vaginal cream.
Okay. I mean, this all sounds pretty easy in the grand scheme of things, like something topical or something that I take as a pill that doesn't seem too intrusive as far as the way the treatment's administered.
Correct. Although there's a lot more out there. I mean, there are compounded medications also, there's pellets. So there's other forms of medication, but I like to stick with the FDA approved medications for hormone replacement therapy.
That makes sense. Very wise. I think that's probably what we want to. I know I'm spending a lot of time on this, but I just feel like women so want to know about this, and we'll talk about other things too. But okay, so on the hormones, if you do start taking them, then do you take them forever, or is there a stop to that?
If your menopause is early, if you're in your 40s, you can take them till the natural time of menopause, 52, say, or you can take them during the times that you're most symptomatic and then stop them. So there's different ways that you can do them. There used to be a recommendation for a hard stop, and that's not necessarily true anymore. And then the hard stop would be after 5 years of taking the medications because there was the concern about the risk for breast cancer.
Not to be vain, but are there any aesthetic benefits? Does it help your skin, your hair? Does it make you look younger? Is that a part of it?
Definitely is a part of it. So it helps protect the collagen in the skin, so the elasticity of the skin, hair growth, prevention of wrinkles. So yes, all those things. Although that's not the reason we prescribe them.
But it's a nice value add.
It's a nice benefit. Yes.
It's a nice benefit. Okay, I feel really educated on that. So thank you for masterclass in hormone replacement therapy. I feel like so many women, especially listeners to this, we're in this era of our lives. So we're so curious.
Yes. I think education is going to be a big part of what's happening in the future for everyone.
If somebody listening is thinking, oh my gosh, I want to try this, do they bring it up to their primary care doctor, their gynecologist, either? What should they do as a first step?
The gynecologist are a good place, or your primary care physician, because all of us have this growing knowledge about hormone replacement therapy, though it wasn't something that was taught in medical school or residency. It's things that we learned in our practice and has become a focus of education in the last several years.
That makes me happy. I've heard something before where menopause wasn't taught at all at medical school or taught very small. So, am I hearing that that's changing and we're having a little bit more formal education on these things?
More formal education for the practitioners, and I'm not sure what's happening at the training level currently. I think certainly will be a greater emphasis on it in the future.
Oh, I'm so excited for the future, people. More knowledge. Knowledge is power.
Agree.
Okay, on the topic of prevention and thinking about our longevity, I've also seen an influx of voluntary preventative measures like the Prenuvo scan, that full body MRI you can volunteer to do, which I did last year. Then I see things for like blood tests that you order to your house that give you some type of assessment of your cancer risk or something. So it seems like there's more stuff going on there, but I don't know how medically sound it is. What's your take on all of these new voluntary things that are available for prevention?
Yes. So the Prenuvo scan is a full body MRI scan for early detection of cancers. And it doesn't require a prescription from a provider. So patients can go and order the test themselves. The full body MRI scan, while we're supposed to have early detection of cancers, so that's the benefit, but also in addition to early detection of cancers, there's a lot of incidental findings on imaging for which you may need to follow up with serial imaging and perhaps biopsy. But in response to that, if they do find something that is of concern, you can have it evaluated early before the onset of symptoms and hopefully treat early. So that's the benefit of these types of studies is early detection and treatment and hopefully better outcomes. So if you do have something that shows up on the whole body MRI, it's not diagnostic. You have to continue to do either imaging of that specific organ and possible biopsy as well. It's a screening test for cancer. So the limitations are that it's costly. It's several $1,000s. It's not FDA approved, so it's not covered by insurance. And then you have the downstream of following up on these abnormal results, which if it's not cancer, it's following up on these incidental findings that might cause a lot of anxiety and also be costly because we're not certain if all this will be covered by insurance. And then the multi-cancer early detection test, such as the Gallery test, is a blood test. And the blood test, it's 2 vials of blood, and then it's analyzed, and then it can give you organ of origin, so a potential site of where the cancer might be coming from. So it is based on the fact that the cancer sheds DNA into the bloodstream, and that's how we do the early detection of the cancer.
Interesting.
Yeah, it's fascinating, but it's not a diagnostic test because once you have the organ of origin, then you need to follow up with imaging and possibly biopsy to diagnose the cancer. And then again, it's a costly test and it's not FDA approved. It's not covered by insurance. The American Cancer Society has been looking at funding to continue research on that type of early detection. And both these early detection of cancer, it doesn't take place of your routine screening that we recommend, such as mammogram, pap smear, PSA for men for prostate cancer, CT scan for lung cancer screens, and then colonoscopy. So we have 5 types of cancer screening that are approved. Those tests, like the Pernuvo whole body MRI and then the Gallery test, the DNA test, are not FDA approved and they're not covered by insurance. We still counsel patients to do the routine age-based cancer screening.
That's a good point to include that this isn't a way to get out of all those other things that we know work and have been proven. Yeah.
Yes, it doesn't take the place of a mammogram and it doesn't take the place of a colonoscopy. So it'd be in addition if you do those.
Hearing all of this, that was a great explanation of the pros and the cons. What's your feeling on it? When I heard about Prenuvo, I heard about it because there's an article written that Kim Kardashian did it. And of course, I always think, well, celebrities have access to everything. They could stay healthy forever because they probably have unlimited resources. And then I was like, it seems so cool that you can go and get this done. But I paid $2,500 to do it. I'm a healthy person. Luckily, it showed healthy things. I learned that I have dense breast tissue, which I feel like is a good piece of information for my future, and mammograms, ultrasounds, all of that. But I recognize the privilege that I could pay $2,500 out of pocket to go and do this. What's your feeling on this? Is this a good thing? Is it helping with anxiety? Is it causing anxiety? Do you feel like the more people, could this get popularized to a point that maybe it would be covered by insurance? What do you think about this?
I think it's available for people who are able to manage the anxiety that might be associated with following up with these incidental findings. I think the people that it may be useful for are to look if there's a family history of ovarian cancer or pancreatic cancer. For those types of cancers, there's no screening test available. So that maybe beneficial to them, though you could do targeted screening for pancreatic cancer, such as imaging of the pancreas in different modalities, or for ovarian cancer, imaging of the pelvis, rather than doing these whole body MRIs and these Gallery tests, the blood test. So that's where it might be helpful. It may be helpful for people who have a genetic syndrome like Lynch syndrome or the BRCA genes, where they're associated with many different types of cancer. So I can see where it'd be useful there. The other thing to remember about these tests are that they haven't been shown to improve mortality. So that's likely why they haven't been FDA approved.
Got it. It's very interesting. Technology advances in healthcare or any space are exciting, but then sometimes there's a downside that we don't always consider right away.
So, yes, what do you do with the wealth of information? It makes it challenging. And I think that's why it's also helpful before doing the test to discuss with your primary care physician. Now, the Gallery test you do need a prescription for so that you have somebody to discuss the findings with you and discuss what the next steps are. But the Prenuvo scans, anybody can order them for themselves. And if you don't have a provider, then you don't have anybody to follow up with, although that might help you identify a provider.
Yeah, you're so right. It's about what you do with the information that you get.
True.
The community that has developed from this podcast is incredible, and I am so excited to meet in real life. We're hosting our first in-person event, an evening of curiosity and conversation focused on the power of self-expression. Picture a luxurious dinner party, luxurious drinks, mingling, mixing here in downtown Chicago on February 19th, 2026. And the event is also stacked with speakers from some of your favorite episodes. Trisha Brook is delivering a custom keynote on the power of using our authentic voice for positive influence. We have a self-expression panel featuring sustainability expert Ashley Piper, transformative wardrobe stylist Shelley Carlson, and nervous system expert Olivia Marie. The event is going to be kicked off with an intention-setting meditation hosted by Nadine Cherry. These are the voices we already love, and now we have the opportunity to meet face-to-face. Come to learn, ask questions, connect with cool child-free women, and embrace the kind of inspiration that lasts through the entire year. Seats are intentionally limited to keep this intimate, and tickets are first come, first serve. So if you've been listening to the podcast and thinking, I want to be part of a community of women like this is your invitation. Grab your ticket by visiting CuriousLifeOfAChildFreeWoman.com/2026 event. I cannot wait to see you there. I want to ask you about sleep. I feel like we as women are conditioned to be go-getters and we're doing things all the time. And I can speak for myself that when I feel overwhelmed with work and social life and all these priorities, the thing that I cut out first is probably sleep. I think, oh, I'll just stay up 1 hour later to get this work done, or I'll get up 1 hour earlier to try to get to the gym before these meetings. But now I feel like I'm hearing a lot that sleep is really critical and maybe even more critical for women than men. So can you explain how important is sleep?
Well, sleep serves a number of functions. For instance, removes waste from the brain, consolidates memory and knowledge. It helps restore concentration. It helps us process our emotions. It regulates our thought and our metabolism. And it can improve our heart risk factors, such as decreasing heart rate, decreasing blood pressure, decreasing sympathetic tone. And it can also decrease the risk of obesity and diabetes by regulating these hormones. It can also improve immune function and also improve fertility. So it has a lot of benefits that we don't think a lot about. And we think for most adults that we need 7 to 9 hours of sleep per night, which many of us are not getting.
Okay, that's so many important things. I feel like you just listed a variety of health topics where we go to so many other fancier or more complicated solutions to improve, to lose weight or boost our metabolism or try to protect our brain health. And then it's like, wait, maybe we're just skipping over the simplest, cheapest thing, which would be to just go to bed.
We're not fulfilling a basic need. Agree with that.
When you said clearing out waste in the brain, what does that mean?
So I think it's probably all these extra thoughts that we have when we go retire. So I think it helps restore our normal brain function in that process of the sleep.
And what about the metabolism and gut digestion piece of this? Why does sleep matter for that?
So good question, because it regulates those hormones like the ghrelin, leptin, and orexin. So it helps regulate these hormonal balances.
Okay, that makes me curious. I feel like we talked a little bit about midlife and how we go through these changes and things start to look and feel a little bit different when we enter this era of midlife. I hear a lot of women talking about lack of sleep, like they just wake up more frequently in the night. They have a harder time getting to sleep or staying asleep through perimenopause. Is that happening because of something with our hormones?
Yes, if they have hot flashes or especially the night sweats can affect the sleep and disturb sleep and prevents you from sleeping. So it awakens you at night.
Do you have any tips, like, when patients come to you, if they're dealing with that? And sometimes I think it makes us more anxious about losing sleep when we feel like sleep is really important. I have to get to sleep. And then you're laying there wide awake, just getting more and more frustrated that you can't get that sleep. If we're in one of those loops where we're waking up every night at midnight or 2 a.m. and our brain starts racing, how do you help patients get out of that or get the rest that we need?
So I think just following the basic rules of sleep hygiene. So not to work or do any computer time or phone time for up to 2 hours prior to sleep, establishing a regular bedtime and establishing a regular wake time. Some other tips are to write down your thoughts before you go to bed and make a list of all your things to do before you go to bed so that you clear your mind before you try to sleep. Having a comfortable, cool, dark, quiet place to sleep, and then reserve the bedroom for sleep and not for doing other things. I think those are very helpful. Minimize or avoid alcohol because that disturbs the sleep, and to avoid exercise before bedtime. So exercise a few hours prior to bedtime because it tends to stimulate you.
So, avoiding things that make our body more stimulated and awake before we're trying to calm down.
And sometimes we forget to talk about that. And it's so important.
Yes. I feel like we have so many little cures out in culture if you're tired or just chronically sleep deprived. Of course, we drink coffee all day, we have energy drinks, we have all these boosts that topically keep us awake, but that's not a replacement for actual sound rest.
I agree. We're always trying to promote wakefulness. And then when we try to sleep, we can't sleep.
Yes, exactly. Everyone listening, I feel like we have a slight advantage in this area that we don't have children because I really feel for my mom friends who have little toddlers or babies that are crying in the night or coming into their room or their bed in the night. And it feels like that is such a hard chapter of life when you have little kids, it seems, to get a good night's sleep. So maybe those of us who are child free, let's take this as a reminder that we have maybe a few less barriers to that good night's rest. We should try to prioritize it.
Agree. We should promote restfulness for sure.
I get the sense that you support a lot of ambitious women and busy professionals and people like that in your practice. Do you feel like there's a societal thing where women, because we are conditioned to try to do it all, we have so much responsibility every day, do you feel like we're missing this societal focus that rest is actually really important? Sometimes I feel like we judge ourselves or we feel judged based on our output and just how much we produce in a day. And that makes it seem like it's weak or lazy or something to rest. Does that make sense? Do you know what I mean?
I agree. I mean, everything that we do is to promote how ambitious we are or how effective we are, but we don't promote this very basic need is our sleep. I totally agree with you. And we're always connected either by our cell phone, our computers. We're always connected to the workplace. it's valuable to be able to put that away for a set amount of time during the day.
I totally agree. We can try to start a movement with the two of us and everybody listening because it's hard. It's really hard.
Agree?
At least I feel like I'm doing something wrong if I'm not available to my clients. And at this point, I own my own business. I don't even have a boss that has an expectation. I continue to set the expectation that if there's an email that comes in late at night, I should get back to it, or I should get up extra early and respond to it. I don't know. It's like this psychological craving or something to be always available, and I feel like it's starting to do more harm. And then we hear this stuff about sleep, and it's like, wait, maybe we can use this data as some ammunition to help ourselves disconnect. It really, really is in our best interest to get this rest that we need.
Agree.
Okay. Thank you for the context on that. And I want to talk about women's health in general. I love that we've gone deep on hormone replacement, midlife health, a few different topics. But for you, as somebody who is in this field every day and on the cutting edge of what's coming next, what do you see as the future in women's healthcare? What makes you excited?
What I hope for is we make healthcare a priority because I think we put so many other needs ahead of our healthcare that we wait till a time that we have symptoms or something's wrong to look for good health care. I think partnering with a good primary care physician for which you can have ongoing continuity of care rather than just care at your annual visit, I think is really helpful. And have an ongoing conversation. Say if you're under the treatment for hypertension or diabetes that you're seeing regularly to see that things are well managed. If you have side effects, you can make changes. So just having that open, ongoing conversation, I think is really helpful. And then also shared decision making for any of these things that you're being treated for. If you're not responding well, or whether you're responding well, to have this ongoing conversation so we can make changes if we need to.
I appreciate that relationship element to this. I think women are naturally relational creatures. We like to talk things through with our friends or our partner and maybe get input and just have productive conversations. But for some reason, often when it comes to our individual health, I feel like we don't do that. It becomes this private, secret thing, and you don't really know who to ask or where to start. And it sounds like you're hoping that changes.
I hope that changes. Yes. I think more time with your primary care physician too. Make regular appointments just to check in, I think is really helpful too.
And how do we do that? If our doctor's not proactively encouraging that, do you recommend that we just try to have more than one appointment on the books every year? What can people do if they feel like their physician's not really meeting them halfway, but they would like more points of contact? How do they do that?
Yeah, I think it would be reasonable to make a 3-month follow up visit, especially if you start some new treatment plan, to make regularly scheduled visits. Because oftentimes we may not be seeing you unless there's a problem.
Yeah, I keep hearing and I feel like I want this baseline relationship so that you're in good communication when everything is fine. And then maybe it's a little bit easier to see the changes when something does happen.
Oh, agreed. Yes. So I think regularly scheduled appointments is really helpful. Not always possible unless you schedule ahead of time. I think what is happening is at times when you're sick, the appointments aren't available with you for your primary care physician.
Yeah, there's nothing more frustrating than feeling like you have a problem that feels extremely urgent to you, and then you get this response that they can get you in like 6 weeks or 8 weeks or something. It's scary.
Correct. There's other physician's assistants or the nurse practitioners or physician extenders who are available to you, though you don't have this ongoing relationship with them necessarily. Just during times of illness when you need that immediate care appointment.
A good reminder too to kind of use the resources we have. And to give a personal endorsement, if anybody listening, it's annoying that we need extra resources to do this, but I have become a huge fan of concierge medicine as an umbrella term. And Dr. O, I know that you are involved with that at Beyond. And I wish that everybody have access to concierge level care. But from my perspective, while I wait for the global healthcare system to catch up to that, if you have the means to do it, it's been a game changer for me from that relationship and just access perspective.
I agree. It's nice to have that ongoing personalized care from a provider standpoint and from a patient standpoint as well.
Yeah. How do you feel about it as someone who's worked on both sides of the equation in more traditional medicine versus more concierge?
So I feel like I have more time to spend with my patients and more personalized care and more continuity of care, which I appreciate as a provider.
Yes, I'm sure. That's the thing. It's not the provider's fault either when things are overscheduled and you only have so much time for an appointment slot. I see where things need to improve on both sides,
Yes. And it's really helpful to be able to see your patients when they're ill and also when they're well.
and we appreciate it. I want to know you when I'm well and when I'm ill. I want to know you all the time in case I ever need something.
I'll have to add this. I remember you wanted to come in when you felt well for your annual exam so you could appreciate the whole process.
Yes, definitely. I'm so grateful that I can get care if there's something wrong, a cold, flu, or anything else going on. But yeah, I want some kind of understanding and record of how my body is behaving on the best days in this age, in this era, so that as things inevitably change, as time goes on, we have something to look to and be like, okay, well, this is a little bit different than when you felt fantastic. So, yeah,
It's definitely a valuable experience for both the providers and the patients.
yes, I love the relationship. Beyond this and the standard of care, are there any subjects that you feel we're not talking about enough yet in the world of women's healthcare?
I think the things that are relevant are providing menopause support for women in the workplace. I think the other things are prevention of cardiovascular disease in women. I think all those we should pay more attention to and have more of a conversation. Prevention of things such as cancer. Those are all topics that are people want to talk about. And oftentimes we don't get the chance to talk about them until the annual exam. But maybe it should be an ongoing conversation.
Yes, I want to prevent cancer. And tell us more support for menopause in the workplace for those people listening who do own a business or have capacity to change policy. What does that look like just at a high level?
I haven't actually seen it myself or witnessed it, but I know some companies are providing menopause support like they do pregnancy support or maternity leave. I would like to see what companies have in place currently because I know there are some supportive systems that I would like to see.
That's really interesting. I haven't heard that, but it makes a lot of sense. Even as somebody who's not going to ever use maternity leave, I am very for that. I think that's critical for any person who's becoming a parent, maternity or paternity leave in the workforce. Then we ignore these other major changes that affect our body in big ways as well further down the road.
Yes, there's many productive women in the workplace that are going through that menopause transition and want to continue that part of their life and the career and the workplace and want to continue and need that support.
Okay, I'm going to do research on this. This is intriguing me for things I could offer in my companies. So we'll have more conversations. I'll do research and then ask you what you think. Get your medical opinion. Okay, there's so many things I could ask you, but just to close, if you could give women listening one tip or piece of advice, something they can take away from this conversation to help them live healthier, happier lives, what would that be?
So I would say the pillars of health are regular exercise, a healthy diet, maintaining personal connections, proper sleep, and avoidance of excess substances such as alcohol, smoking, things like that.
It sounds simple. It's hard sometimes in the moment, but they're really important pillars to keep in mind. I appreciate that.
Yes. Thank you.
Yes. Thank you. And lastly, Dr. O, for anybody who is like, oh my gosh, I want her to be my doctor, can you tell people more about where to find you or where to connect with you?
So I'm at Beyond Concierge Medical, which is a wellness facility. We're at 600 West Chicago Avenue, and I'm happy to meet with you and see if this is a comfortable place for your health care.
Beautiful. We will make sure that's linked in the show notes. Again, just personal endorsement. I love it. It's been a life changer for me. So if anybody has questions, you can DM me too on the patient side of the equation. Dr. O, thank you for spending time with us. I love your insights and your expertise. I really appreciate the conversation.
And I appreciate your support. Thank you, Emily.
If this episode sparked something in you, come and join the conversation on Instagram at Curious Life of a Child-Free Woman. You can find more stories, guest insights, and moments that remind us why curiosity is so important. Speaking of curiosity, we're hosting our first in-person event, an evening of curiosity and conversation, February 19th here in downtown Chicago. Seats are intentionally limited and tickets are going fast. So get yours by visiting CuriousLifeOfAChildFreeWoman.com/2026 event. And serious bonus, our keynote speaker, Trisha Brooke, has generously offered our listeners access to her free monthly workshop series. To learn more and sign up for the workshop, visit the link in the show notes. Until next time, let's stay curious together.